Welcome to the Birthling Podcast, presented by My Friend's a Nurse. I'm your host, Colette, a high-risk labor and delivery nurse right here in sunny California. I'm also an OB certified specialist, birth educator, lactation expert, and mother of two beautiful daughters. I am passionate about guiding you through the miraculous journey of pregnancy and childbirth, using evidence and history and asking the reason why. I have some incredible medical friends and colleagues, and we're all here to help you navigate this often overwhelming birthing hospital system in the United States. My goal is to gain trust in birth, improve this system, and provide some valuable insights. Let's make this journey a little less daunting and a lot more joyful. Let's get into it. Welcome to the Birthling Podcast. Today, we are going to get into pushing positions and how to reduce tearing during childbirth. If you go back the first 15 series, I went over everything that happened like directly after birth, right? Those 15 to 30 minutes where, especially those first 2 minutes, right? Where you don't know from top to bottom, right to left, you don't know what's going on. That's not the time that you want to ask all the questions and give informed consent, and from episiotomy to cord clamping, all the stuff, right? So I thought going backwards, this is going to be a great episode to kind of continue with. I know it's at the second stage of labor during pushing. This is just before you deliver, but you're 10 centimeters. We're like, okay, it's time to push. Your nurse comes in, maybe she checks your cervix, or you feel a lot of pressure, right? You are like, I feel like I have to have a bowel movement. You are in tune with your body. You understand that something just changed. Something happened. The baby entered the birth canal. It's time to push. It's time to deliver, right? Maybe you have a really heavy epidural, right? Sometimes I tell moms, if you have like all of a sudden this increased rage, or like you get really angry at your partner, I tell your partner like, okay, if she's laughing 1 minute and then second she like wants to throw something at you, call me, because she may be ready to deliver. That she may be not only 10 centimeters, but baby's well engaged. You could really go like completely numb in your butt. I should have just said numb once, because what's numb, but numb in your booty, things like that. Just something changes. I started throwing up like crazy, like projectile into, I asked for the emesis bag. It's a little blue bag. So know where that is. Maybe just have one next to your bedside at all times when you're in labor at the hospital, because you never know what's going to hit. But I knew something had just switched, got switched. Something got switched where I knew something was different. I started throwing up, and then I called my nurse. I said, call the doctor. It's time. Baby's coming. Like I knew. I transitioned. Last time she had checked my cervix, I was 7 centimeters. I didn't need her to check me at that point to tell me. I didn't mind if she did, because I knew. Like if you want cervical exams, great. If you don't, if you are like, I don't want one exam, risk of infection and all this stuff, then you can refuse the exam. But you really then need to understand your body and understand these like weird symptoms that you're going to feel, especially if you have an epidural. And I had a really heavy epidural, you guys. That's why the throwing up was such a sign to me. We could also see in the fetal tracing. So we're watching your baby's heart rate. Sometimes they'll have like this weird random deceleration. And I will go in and be like, yeah, she's ready. We'll be out there as nurses watching that baby's heart rate and watching your heart rate and call it. Like, we'll be like, hey, I think your patient's 10 centimeters. I think she's ready to push. We don't even have to see you. It's crazy, but it's true. So understand all those different signals that your body is sending, that the heartbeat of your baby is sending. And then you can also, of course, have them check your cervix at your consent. Okay. You don't need to have them check your cervix, but it does help us know like how fast are we running, right? A great nurse will have that room ready for you in 2 seconds, exam or no exam. And know the signs and when to call the doctor. And then they might want to do a little test push with you. They may want to check your cervix while you test so that they can see how well you're bringing that baby down. If they know this is going to be 2 hours, 3 hours of pushing, they don't want to call the doctor in right away, especially if you're at a hospital where the doctor is sleeping at home. It's 3 a.m. They're not going to call the doctor right away. Just understand that. And sometimes if you're at a teaching hospital, then the resident is the one that's going to come in and check you or tell you it's time to push. A lot of them no longer want to do the whole quote unquote laboring down. So maybe the baby's really high and you're not feeling any symptoms, right? But they're randomly checking your cervix like every 2 3 hours, and they find your 10 centimeters and they're like, okay, let's just start pushing. We don't want to risk infection and all of that. Well, you could reduce infection by not checking every 2 hours. That could be a start. But if you do that and then they want you to push and the baby's high, it will probably reduce the risk of infection or just getting the baby out sooner. But also it could be hours of pushing because your body's actually not ready. So we'll speak about that. Maybe call me. We can have our own coaching call or discovery call. Or if you're a client of mine, you are definitely going to learn about the options of laboring down or having your cervix checked and what that means and what it means to decline it and what signs to look for so you know you're ready to push. Okay, so now you're ready to push. Let's just say you have the signs, you know you're ready, your body's feeling it, you can feel baby pushing down on your rectum and you feel all the things let's do this. And that means epidural or not, ladies. What do we do? On this episode, I want to talk mostly about pushing positions and why and what your pelvis is doing, what your baby is doing, and then how can we reduce tearing. So this is a lot of information. I'm going to kind of squeeze it all in here. And if I have questions from you guys, maybe in my DMs, in the comments of the episode, or find me on Instagram and there's specific questions on this, then I can make another episode on answering those questions. But this is going to be a pretty general educational kind of topic. There's going to be a lot of information, so listen, and then you can always go back and take some notes or just DM me and let's chat. What did you hear and what did you like and what didn't you like? Right? So, okay, basically in the hospital, and I know for the most part, the most common position when it's time to push is this robotic, I shouldn't say robotic, but this transformer bed swings out these two little stirrups. They come out and we put your legs in the stirrups and we check your cervix, and some nurses and doctors will immediately put that bright spotlight on you. I just want to prepare you for this, okay? So and if you're cool with it, great. But remember, all these things, this position is very vulnerable. You're opening yourself up. You've had a pap smear, right? Just with the doctor alone in that room, it's a little it's intimidating. It's a lot. It's vulnerable. I can't even think of another word to describe it, but your body is not going to be so receptive to staying calm and allowing your pelvis and your body to relax so that the baby can rotate and descend, and the hormone relaxin can do its job to get the pelvis nice and open for a smooth and quick delivery. So of course, if your nurse has you in those stirrups and you have a bright light on you and you're nervous because they just told you your baby's coming, it doesn't matter how prepared you are. Oh my God, this baby's coming. Unless you're so tired that would rather pass out and you're like, nah, I don't think so. I've had patients literally falling asleep in between contractions. Wake up, girl, your baby's coming. She's like, yeah, no, it's exhausting. Okay. Labor and birth is exhausting. So many ways it could go, but for the most part, you're going to be you're going to be nervous, okay? And then the adrenaline kicks in, and that could cause immediate shivering. So you're shaking there. Your legs are in the air. You have your vagina open to this spotlight and this nurse and maybe a resident and maybe another doctor. Your partner is there like, you got this, or doing whatever. Maybe your doula. That's a lot of people in the room. And you're just like, open eagle. There we go. So, and then we're telling you need to be relaxed and focus on your breath, and you're going to push, and how are you going to push? And then they're coming at you like, okay, I want you to hold your breath for 10 seconds while I count, and bear down like you're pooping, and bring your chin to your chest and curl up like a ball, or curl around your belly. Right? Bring your knees towards you, like hold underneath your knees, and bring your legs towards you so you're scrunched up. I used to say like a tube of toothpaste so the baby can come out, and you're going to push for 10 seconds, and then we're going to do 3 sets. Okay, ready? 1, 2, 3, 4, 5. You get the idea, right? And we're going to do it again. And then you're like, you're out of breath, and you're like, oh my God, and it's a few of those, and you're like wiped out. Okay, we'll give you a sip of water. You don't even know to ask for it. Maybe you need a cold cloth. Then your baby's heart rate starts dropping in between, because, girl, if you're out of breath, your baby's going to be out of breath, because your blood is carrying that oxygen to your baby. And if that baby is not recovering fast enough, then they're going to start having decelerations. Oh no. So then the doctor's going to start getting worried and be like, well, we can't let you push for a long time like that. So, we better get this baby out, or it's going to be a C-section. So now you're just like, okay. And hopefully you have a good nurse, and she's putting you in all these different positions, like on your side or whatnot. And you're just kind of following her lead and telling it like, okay, tell me what to do. Most of the time, most all moms are leaning on me to tell them what position to get into. I can literally, in 8 years, like maybe 20 moms have pushed how they wanted to or have prepped. And it's alarming, especially since a lot of that time I just told them to do what I was trained to tell them to do, which is exactly the scenario I told you. And my hands were massaging their perineum to decrease tearing, which is, doesn't help. Now we know a warm compress can help, but just a little bit. Sometimes it just feels good, but yeah. At the same time, like, they got to be solid people to be able to, not just solid, because you're solid, like you are solid. I just mean very comfortable in that situation. And I don't know a lot of women that are. And baby just has to be in the perfect optimal position to deliver quickly and without incident. Okay. If not, of course, the doctor's going to step in, and that's when they may need a vacuum. They may need forceps, which I don't see a lot anymore. Episiotomies, which I don't see a lot anymore, but those both exist, or a C-section if it's just been too much, or the baby's not tolerating it, or you've pushed for 2 or 3 hours with the baby not advancing. But why? And what can you do to make sure that doesn't happen, right? It starts during your pregnancy. It starts later in pregnancy. Your body position is so important. How are you standing? Are you opening up your pelvis? Are you pushing your pelvis forward while you stand, or are you just hunched over, right? That baby's not going to be able to get an optimal position with the head engaged sooner than later, and they may fall behind that pelvic bone, or they may not be able to turn correctly during labor, and all of a sudden they are facing up instead of down. Like, optimal positioning is your first best bet for a smooth and quick delivery and reducing tearing. Okay, because if the baby's breech or facing up or a little transverse, if they're not in the optimal position with facing your booty, head down, then it's going to increase your risk of tearing. Being tense is also going to increase tearing. So we need to understand during pregnancy what we can do to help not only strengthen our pelvic floor, but learn to relax it as well. Our mindset is so important. And then, of course, communication, speaking up for yourself, advocating for yourself with a birth plan and the team around you that can speak up to the positions that you want to push in and deliver in and what that looks like. Okay, so that's going to be your number one best bet to not only reduce tearing, but have a quick and smooth, safe delivery, which I think we all want, right? Why do we do this? Why, if it increases the risk so much of prolonged pushing, of the baby not getting an optimal position, right? Increased tearing, why do we do it? It's just so common, right? Well, couple of reasons, I would say. There's a little wives' tale out there of King Louis the 14th, right? The story is that he enjoyed watching his wives and mistresses give birth. I guess there's a lot of them. He has a lot of babies, right? He's royal, but he enjoyed watching them give birth. But when they were like on birthing stools or standing or in a squatting position, he didn't get the best view. So he promoted reclining or laying on your back, I should say, so that he could see it better. I recorded a reel with some friends, some doulas and birth workers and a midwife and a lactation consultant. And I'm going to edit this out and it's going to be out this week with this episode. I think it's funny, but I just want to point out that it's alleged. Okay. I don't have any hard proof or facts about this story, but I'm going to go with it because it's a man, it's a king. He said it. It's obnoxious and I don't know, makes sense. I bet you it's true. These kings. But let's talk about other factors, right? Like the rise of medical physicians that were replacing midwives, right, in the 1800s and early 1900s. They moved towards hospital deliveries, right? So in the hospital, they got these hospital beds and with doctors, and of course, improved vision of what was happening was optimal for them, right? It also helped them with the surgical positions, forceps or episiotomies. And remember, I don't know if you can go back with the episiotomy episode. I talked about that during those times. 1920s became really popular. In 1950s, they thought they could just bypass the pushing stage altogether by having moms lay on her back and using these forceps and episiotomies, right? They can only do that if you were laying on your back. And so that's why they got these stirrups and that you put your legs in and you lay on your back and you have your epidural and they got the baby out for you. And that kind of just stuck, right? Even when there were midwives saying, hey, no, we need to get them upright. This isn't natural. It's increasing hemorrhaging and tearing and all of these things. No, it really is still so common to lay on your back and be managed. And we manage the third stage as well. And then just being in the bed at the hospital, it's like, I heard another podcast and she's just like, we spend a lot of money on these beds and we want to use them. Are these the reasons you want to lay on your back? Okay, better not be. Now, if you're freaking tired, like I get it, then go ahead and lay down. Push while you're laying down. If you don't mind your hoo-ha showing to the world and you want to grab your legs and get that baby out, do it. Girl, I did. It's fine. Like I was comfortable as long as you're comfortable and as long as it's your choice, right? But this, for their convenience and for a king, because he wanted to for them to see it better, has nothing to do with you. And that's where I hope choice isn't taken away from you and they're just telling you to get on your back. And it's going to take a team, you guys. It's going to take your partner speaking up, your doula, your nurse, everyone around you speaking up and advocating for you and your decisions and what decisions you want during your pushing stage. Let's talk first about what happens to your pelvis and why some positions are better than others. It's not like your pelvis opens. Your pelvis stays the same shape. So if you're thinking everything kind of moves around and my pelvis opens up, they're not actually opening as much as the ligaments around them and the joints, connective tissue. They're going to soften and become more mobile, maybe a little stretchy, and they move. As you change your position and move around, the opening moves. It's not just a solid structure. If you lay on your side and bring your leg up, that opens the upper part of your pelvis. Or the more you change your position, you can work with me, or you can work with a physical therapist, a pelvic floor specialist, and learn what positions open optimally for the stage of birth you're in. In my course, I have a whole lesson just on this. So you really want to learn how your positions affect your pelvis opening. You have a hormone called relaxin that I had mentioned, and that plays a crucial role in that process, helping the bones become more flexible for them to move easier. And you have to allow that. So think of that way, okay? Okay, relaxin is what is going to help my pelvis soften and open, which means I also need to relax. I can't be tense. Both things help. They're separate, but they both help, right? Your shape alone is going to affect how the baby descends and turns. So you can't change that, but you can help optimize it by getting on all fours, perhaps. Getting on all fours, like so your hands and knees while you're pushing or squatting, it's going to open up your pelvis maybe by like, I forgot what it is, 10 millimeters or something significant. That's significant. Hold on, let me turn my heater off. That's when you're talking about you just need a couple of millimeters, that's significant. So if you have a bigger baby or, you have gestational diabetes and you're higher risk for shoulder dystocia, that's something that you really want to think about is what positions you want to be in that will optimize the shape of your pelvis and optimize the relaxin and the hormones. All of those things are so important. And then join a class like the Birth Link that will give you a lesson on how your pelvis works, the inlet versus the outlet, and what positions will help. But then also movement and gravity. Gravity is essential to help your baby descend. So hey, you're 10 centimeters, is that really the time that you want to lay flat? Right? If you don't have an epidural, then get up. Use gravity. If you just can't get up or your epidural is too heavy, then ask them to turn it down a bit and then use your breathing techniques and refocus to get through the pressure. And then get on your knees, turn around on the bed and try to squat, right? You can get a birthing bar. Ask your nurse to bring your birthing bar and set that up, and you can hold on to that. So you can set the edge, the bed, the foot part of the bed lowers down, and you can sit at the edge of the bed and you can hold on to that birthing bar and you can squat. So use gravity and your position, opening up your legs. Sometimes you close your knees together and that can open up the top part, right? The inlet part of your pelvis, and to help the baby descend and become engaged. So squatting, hands and knees, standing, even walking, believe it or not. Try the toilet, right? Sit backwards on the toilet. Don't worry. If your nurse is right there, your baby's not going to fall into the toilet. You can do all these things to help. Sometimes that will be enough. If you don't want to get out of bed or you have an epidural, you can push on your sides. You can push on your back, but just sit up more and get your legs onto that birthing bar. If you don't want the stirrups, or if you're okay with the stirrups, use the stirrups and bring your legs, bring your knees towards you and push that way, right? And if you feel vulnerable, then cover up. Put a little sheet over you or your gown over the middle, and your nurse doesn't have to be sitting between your legs. And for crying out loud, tell them to turn that spotlight off. Like, they don't need it. Think about you. Think about your birth plan. Think about what's important to you. What are your values? What's the most important thing? At that time, it really needs to be protecting your privacy and your space as much as possible. Maybe you need to have the doctor and nurse there, of course, but do you have to be exposed in such a way? No, not necessarily. Right? Even if you feel like, no, I'm fine, I'm safe, they know what they're doing, your body's like, no, I do not want to be exposed like this. Your pelvic floor, they're going to be telling you to push like you're pooping. That's a lot of pressure that you may be pushing onto your pelvis. Your pelvis is there normally to, support your core, your abdomen, and your organs there, your bladder and all that. And at the second stage, your pelvic floor muscles, they go through a lot of stretching to allow the baby to descend, right? So you really need to relax your pelvic floor during pushing and not tense up and tense those muscles. So practice that now. You can start practicing right away. Like I laid on my back. I didn't like squatting all the time, but you can squat. It's like a yoga pose. Just sitting up, you can hold on to a chair. You can, if you want to, lay on your back with the legs against the wall and your butt against the walls in a little squatting position. All these things can help in short increments, right? Maybe like 10 minutes at a time for positioning. Then let's discuss, now that you know why we care about your positions and what happens with your pelvic floor. And let's just review, upright positions are best, okay? So if you can, stand, walk, squat, use gravity to help that baby move down the birth canal as much as you can, okay? Let's talk a little bit about the risks of tearing, okay? So we have 1st degree to 4th degree. 1st and 2nd are the most common, and sometimes there's not much you can do about it or to prevent it. You can do all the perineal stretching at home you want, but you still may get a tear. But it does help with the 3rd and 4th, and the 4th goes all the way to your rectum, which is brutal. A lot of moms that get 4th degrees end up having a C-section for their 2nd baby. You want to do things that can prevent that 3rd and 4th for sure. Some of the risk factors will be like for first-time moms or large babies, a really fast birth, we call it precipitous, but baby's just coming out. Body doesn't have enough time for that relaxin hormone and positioning to stretch out the vagina and the perineum enough. So the perineum is going to tear, right? Also, like I mentioned, the baby's position can play a huge factor if the baby's looking up or breech. So you want to really focus on your positions before labor and birth to make sure that it's optimal for baby to descend before you even go into labor. And then things also like instrumental deliveries, pushing for a really long time, like 2 hours or more, and shoulder dystocia. Those can really impact your risk of tearing. If you decide, if it's just like tearing is the biggest fear, and during labor and birth is when those hormones come in and everything relaxes, not during pregnancy, right? So you can do perineal stretching before you go into labor. Maybe you want to start like 37 weeks, 36 weeks to start slowly stretching little by little. It may and can decrease your chances of those 3rd and 4th degree tears. But also just know, like, getting your baby in the right position and mindset and being relaxed is probably going to help you more than perineal stretching, because your body, once you go into labor, is going to do that for you. So I wouldn't be so concerned if you're like, this is not what I want to do. But for those of you that it's just the fear is there, you want to do everything you can not to tear, then you want to try gently massaging your perineum. It's the area between, when I say perineum, the vaginal opening and your anus. Okay, so that area. And you just want to take your 2 fingers and get in there and just gently until you feel like pressure. It shouldn't be painful. And you're just going to use a little bit of maybe olive oil, and you want to massage that area daily. And it can increase the elasticity and flexibility, and then potentially reduce your risk of tearing. But I didn't, and you don't have to, but it can help. That massaging during labor has zero evidence that helps with anything. So you don't have to massage during birth. This is all before. They do have some evidence that shows warm packs during labor. So if your nurse suggests having a warm pack, you can try it out. And sometimes that just feels really good. To me, I see a lot of times the warm pack causes some blood flow to come to that area higher than others. And then when they do tear, it's just like a lot of blood that shouldn't be. So I'm not so sure about it, but I've had a lot of moms say it feels really nice. And as long as they're not massaging you as well, you shouldn't have any issues. And then proper diet, you guys, eating right, focus on your exercise and staying well and having a healthy pregnancy, having great body mechanics, strength training. That's all really, really going to help during pushing. When I push with a mom at the bedside, I can usually tell if they work out. I'm not going to lie. Like, do you work out? Because you are pushing so well. Like, yeah, I do. Maybe they walk a lot. Maybe they lift weights, but they're athletic and it does help. Doesn't mean you need to go join a marathon, or, you're 36 weeks and you're like, oh crap, I'm going to go do some squats at the gym. But stay active, especially if you're early on in your pregnancy or you're not pregnant yet. Focus on your nutrition, your health. A healthy body should aid you in those quick deliveries, right? Your breathing techniques while you're pushing are so important as well. So that goes along with your mindset, but being vocal if you can. Those low moans, I think I discuss it in my course. Sometimes I get confused with what's in my class and what I put on the podcast. But these low groans, these guttural groans, like oh, that while you're pushing, it is so good. It's really good during transition. So if you're like 8 centimeters and you're trying to get to 10 centimeters, use that tool. If you don't have an epidural, they sometimes come so naturally. If you're just quiet, do you, girl, but don't hold back if you feel those groans coming. Breathing, you have, multiple different ways you can breathe. Closed glottis. So that's kind of what the doctors and the nurses are going to suggest you do when they tell you to hold your breath and while they count to 10. That's closed glottis. And then there's open glottis pushing, where you're going to open and breathe while you push. That helps relax your pelvis. There's literally no evidence that there's any difference between the two. I have just found that with open glottis pushing, the babies do a lot better. They're getting the oxygen they need. You're breathing when you need to breathe. Doctors feel for some reason, and a lot of nurses, that you're just not going to push effectively enough. But sometimes it's not all about this hard, heavy pushing with all your might. And it's more about relaxing your pelvis and getting in the right position that aids in your baby's descent. Because your uterus, you guys, is so strong. It's the strongest muscle you have, especially when it's time to push your baby out. So if you focus on that and you trust that, you don't really have to push that hard. Use gravity to help you out and breathing to help your baby and you, in case it's going to be a long run, and work on your mindset. All right. I hope this episode was helpful. I know it was a lot of information that I just kind of packed in there. I'll probably re-listen to it and pull out stuff that I liked and maybe do another episode to make it more clear for you. But I hope you enjoyed it. I wish you some amazing pushing. And if you're going to have your baby soon, then congratulations. And I know it's going to be awesome. You're going to do the best you can. I know it. But contact me and we can talk just one-to-one, and you can join the BirthLink membership. Go to my website, myfriendsandnurse.com, and sign up now. And if you're not ready, schedule a call so we can chat. Until next time, guys, I'll see you soon. Thank you for listening to My Friends and Nurse presents the BirthLink podcast. We hope you enjoyed today's episode and found it valuable. Before we go, a quick reminder. The information shared on this podcast is for educational purposes only and should not be considered medical advice. Always consult with your healthcare provider for any medical concerns or questions. If you enjoyed the episode, please subscribe, leave a review, and share it with your friends. Your support helps us reach more people and continue to bring you great content. Until next time, stay healthy and stay informed.